I've been a police officer for 29 and a half years now, and I was a very, very active individual, played all kinds of sports, always on the go, loving life. When I hit the age 40, my back problems caught up to me, and it was the equivalent of taking a race car and putting it up on blocks. And it changed my life, changed my demeanor, changed my personality, to the point where I was miserable being me. And I know it had to be miserable for people being around me.
I'm a sailmaker, and I work on sailboats, and I spend a lot of time on my knees and a lot of time lifting things, and so I could come home with a sore back, but it would be good the next day.
My back injury took place in 1991. The cause of my spine problem was fairly straightforward. It was a work-related injury in which I was just in a very awkward position doing a physical task. I heard my back tear. It was excruciating.
I was power washing my home and I was electrocuted. I was thrown in the air, and the last thing I remember is my feet were above my head, and I hit the back of my neck, and I also fell hard on my back. I was rushed to the emergency room, and they did an x-ray, but right when the trauma happens, it's really hard to tell. And I basically dealt with the pain for a year.
I guess it was mid-January of 2007. Shortly after I had an injury that was directly related to my back. I knew it, almost knew it immediately that it was my back. I had the symptoms straight down my leg, sciatica symptoms, pretty typical. And it hurt a lot. I didn't really know what it was. Tried to deal with it as best I could. And from that point forward, I knew I had something going on, especially after I saw a doctor.
It seemed that in early '03, the pain started to increase, especially with any kind of exercise. I'm an avid cyclist and an avid skier, and noticed that during the spring and summer of that year that my hips began to increasingly hurt more and more as I cycled. As winter came around and I started skiing, it became even more difficult. If I was to get any kind of air and come down on my feet, the pain just absolutely shot up my back, and so ultimately it ended up sidelining me from both cycling and from skiing.
Probably in the last 10 to 12 years, I've realized the pain in my back was increasing to the point where it was interfering with my career and my social life.
I had a lot of pain, but I had a lot of faith that it would go away and heal with physical therapy and so on. And unfortunately, it didn't. It continued to progress.
It got to the point where I wasn't sleeping at night. I couldn't even get a full night's sleep. I was in pain all night. And this was perhaps a week to 3 weeks subsequent to when I think I finally pinpointed the time that I actually ruptured the disc.
I adapted my office by taking a file cabinet that was just about the right height and taking my laptop and putting it on the file cabinet. People got used to me standing in meetings, and everyone knew that I had a back problem because they could see it in my face. I was in a lot of pain. And so I did the best I could, but I was finding it difficult to concentrate. The pain was taking too much of my attention.
I was in a place where, well, my kids joke about it now, I was always on the floor. And if they were going out with their friends to Dairy Queen or something like that, I'd be asking them to bring me back something because I was on the floor. And that's where they remember me being for a large portion of my life. And it makes me very sad to hear them joke about it, but now to know that they're joking and to have me up and about, I can laugh at it too.
As the causes of spinal problems are varied, the onset of pain may be immediate or gradual. When a catastrophic accident results in pain, it is obvious that an injury has occurred. However, the extent of the injury is not always apparent. If the injury is not immediately debilitating, many patients assume the body will just heal itself. Disc diseases may progress slowly, and it often takes patients a long time to realize that their quality of life has deteriorated to the point of centering more on pain management than anything else. Often the severity of the injury is first recognized when family members, friends, or coworkers observe changes in the person's behavior and quality of life. Many times, even these individuals fail to realize the full duration or severity of the pain a patient may experience. Only when the patient comes to the realization that the injury won't fix itself does the long journey to wellness begin. This process sometimes takes years, during which the patient may undergo many different diagnostic procedures and treatments. Dealing with spine problems changes a person's entire life, including family, work, and recreation. A patient's physical problems present a wide range of challenges affecting them emotionally, psychologically, spiritually, intellectually, professionally, and financially. Many relationships are complicated or even destroyed because of a patient's debilitating spine issues. And managing chronic back pain in the workplace is difficult and may limit productivity. In fact, many patients become unable to work, further complicating financial issues at a time when money may be tighter and more needed than ever. A patient's battle with pain can be never-ending, complex, and frustrating, as you will hear from our next set of interviews.